Wisconsin's heroin and opiate painkiller overdoses have reached epidemic levels, with the Justice Department saying that type of addiction is responsible for most of the 850 Wisconsin drug deaths last year.
But the parents of many addicts in the state say the health insurance they're depending on to help them save their addicted children's lives is failing them.
Even with the Affordable Care Act, the insurance commissioner's office says large Wisconsin businesses do not have to cover addiction treatment. Caught in a constant state of rule confusion, parents say the insurance system is banking on their children's failure. Our Matthew Simon reports.
These stories are just heart-wrenching.
As heart-wrenching as these parents telling their children's opiate addiction stories is,
The more I dug in, the worse his addiction actually was. Actually, the very worst possible, shooting heroin.
it was getting their teens and 20-somethings help after the painkillers, after the heroin.
Because my insurance would not cover a very large portion of this particular place.
That is, for many southern Wisconsin families, the next gut-wrenching chapter in their story.
They told me that I would only have to pay $22,000.
Too afraid of stigma to share who they are.
Too many families are crying.
The head of Dane County's Parent Addiction Network, Ellen Taylor Powell, summed up these letters' bottom line.
The treatment for the disease do not match the current insurance coverage.
That disease, the addiction in heroin's case, usually starts with opiate prescription abuse. Medicine once prescribed for pain, hijacking and forever changing the brain's chemistry. Only satisfied until the next hit.
Thankfully, Cassie's alive. She's got an opportunity to turn her life around.
One of the hardest questions John Nygren says he gets nearly a decade into his 26-year-old daughter Cassie's opiate addiction battle, including a heroin overdose and jail time, is how is she doing?
And she's doing good today. But I also know, as I said earlier, and once you're an addict for life.
My daughter was one of them.
And now, as a state representative, Nygren's heard from so many other recovering addicts' parents about trying to get insurance help.
But oftentimes what ends up happening is that they go to the least costly first. You have to fail first before they go to perhaps what might be the most effective for your child.
An insurance system based on an addict failing is something Madison addiction psychiatrist Dr. David Pierce says he consistently deals with when trying to get his patients Vivitrol shots that block the brain's opiate receptors.
They'll insist that somebody, quote, fail on the pills. And that's a real catch-22, because if you, quote, fail on the pills, what that means is that you've relapsed.
I told them thank you, but we would have to look elsewhere. In the meantime, my son had a 10th hospital stay.
In the same way parents saying they discover a system based on failure.
And will pay out of pocket.
Even if they have insurance.
Oh, yeah.
As they try to get their insurance to help them pay for long-term residential treatment. Today, the websites Recovering Addicts look at show them the country's most famous recovery facilities can cost between $28,000 and $45,000 for 1 month's care. It's hard to find care in most cases for less than $10,000.
And what the insurance company restrictions relate to, will only pay for this while your life is, in potentially in imminent danger.
And comes out and goes right back to the old habit and overdoses, maybe a fatal overdose.
Comrade's mom wrote us about her other son, an EMT, saving the 22-year-old who battled mental illness for years in June after his heroin overdose. Her letter details her insurance company, Unity, denying help 5 or 6 times. Once they discovered he was waiting on a court-ordered drug assessment. We lost my son July 17th to a heroin overdose. His mom writes, a beautiful mind is gone now because the system did not feel he was worth saving. Citing privacy rules, Unity's spokesperson would not comment on Comrade's case, wishing his family sincere condolences. In a statement, their spokesperson says while they cover substance abuse care, anything beyond outpatient services like residential treatment must meet national standards and be deemed medically necessary, regardless of whether the service was requested by the member or the provider or court ordered. If the services are determined to be medically necessary at the requested level care, then the payment for services are authorized.
I was faced with a difficult decision.
But that is not the insurance reality many families in their letters say became their stories after their child's opiate overdose.
You know, there's just too many deaths. Too many families in chaos.
To the dozens of families Ellen Taylor Powell represents, they say their chaos could be calmed by their insurance companies paying to help them, instead of banking on the next failure.
If we're not getting the help and the treatment that is required, if people aren't taking something seriously, don't you think it's adding to the epidemic?
Meantime, members of the state's largest insurance lobby, the Alliance of Health Insurers, who provide about 70% of Wisconsin coverage, say there is no evidence to suggest the long-term inpatient treatment is any better than short-term treatment, and insist that treatment must be tailored to a person's needs based in part on their previous treatment. Tomorrow in Part 2, Matthew will show us how lawmakers are pushing for change.